So the first kind of, if you will, case in point study, 2022 clinical trial. This was in a population of older adults with chronic diseases. Some had RA, rheumatoid arthritis, some had diabetes, some had high blood pressure, just to name a few. But to make the point that these are diseases that oftentimes are accompanied by high levels of inflammation and oxidative stress. So the researchers wanted to know what would happen if we performed 20 sessions of this small oxidative stress via ozone. They found that the group receiving the ozone, the small bounce of repeat oxidative stress, actually at the end of the study had less oxidation and less inflammation than the people who got no therapy at all. And just quoting, medical ozone arrests the progression of oxidative damage accompanied by disease improvement. So it arrested the oxidative stress and it led to improvements in diseases. One of the questions that comes up here is, how do you get ozone? Firstly, do not breathe it. And if you check in with a clinician or you research this online, that's fairly ubiquitously recommended to never inhale this. There's two main methods of administration. One is known as MAH, and this is where essentially you administer ozone into the blood via an IV. There's a more aggressive protocol known as 10 pass, where you do sort of 10 IVs in a row, but nevertheless, IV administration. Second to this is what's known as insufflation. This is where ozone will be injected, not via a needle, but into a nasal cavity, not to be inhaled, into the ears, into the rectum. Most commonly, rectal insufflation is used, and this is absorbed and has that systemic effect. Some research has used it topically, and some has actually injected it into joints. So there's a variety of ways to administer this. But now let's go to what do we know from an evidence-based perspective regarding the use of ozone for these different conditions, firstly starting with infection. Leading with a quote, gaseous ozone is known to damage viral proteins, RNA, and lipids. And that's what you're seeing in this second diagram here, is that, and this is in a model of COVID, that you can damage the COVID virus with the use of ozone, which might be why a 2023 meta-analysis looking at COVID-19 patients who are hospitalized found favorability. They administered the ozone either via IV or rectally. Here's what they found. A 44% decrease in PCR test positivity, a 6% decrease in mortality, meaning death, and people spent 1.6 less days in the hospital. Remembering this is a meta-analysis is really compelling because this means it gives us a summary of multiple clinical trials. So it's not me cherry-picking one favorable study and ignoring maybe 2, 3, 4, or 5 unfavorable studies. This is a real summary of what the evidence shows using ozone for COVID. Additionally, there are other data. These are in vitro, so they're not as high quality, but they at least set the premise of additional antimicrobial, meaning can kill bacteria, fungus, and viruses, implications or effects from ozone. And that's what you're seeing in this next diagram here, where these researchers looked at ozone either alone or in combination with antibiotics to treat Pseudomonas aeruginosa. And what you're seeing here is a number of lines, and for those just watching, I'll narrate. But essentially, they documented that ozone alone had an antimicrobial effect. And when ozone was combined with different antibiotics, in one case vancomycin, the impact of clearing the infection was enhanced. And this might be why, at least more so anecdotally, clinicians are oftentimes combining ozone with whatever the antibiotic or, in some cases, herbal antimicrobial therapy is to try to target and kill an infection. And we do have some data, at least again, in vitro, so we have to be a little bit careful, but showing that ozone is antifungal and also antiprotozoal. The second use of ozone that we covered earlier was for the skin. And I found this image to be quite obvious, I guess, in terms of demonstrating the applicability. What you're looking at here is from a 2020 study in 10 psoriasis patients who had topically administered ozone. And after 2 weeks in this one individual of the 10, you can see a visibly apparent and marked reduction in the appearance of his ozone, or of his psoriasis from ozone. A different 2022 review paper found that 15 of 18 trials demonstrated benefit for the various skin conditions that were studied, whether this be eczema, warts, ulcers, fungal infections, or skin burns. And since this was 18 studies, you saw sometimes the administration was topical or IV or rectal, showing us that the method of administration probably doesn't make a huge difference. Thirdly, before we had covered that gastrointestinal health is one area that ozone may be beneficial. A 2010 randomized control trial in patients with inflammatory bowel disease. So this is where there's autoimmunity and inflammation in the GI tract. In this case, the patient specifically had ulcerative colitis. They combined the use of rectal ozone plus sulfasalazine, which is a 5-ASA anti-inflammatory medication, and they found that the combination of rectal ozone was more effective than just administering the drug alone. Fourthly, we mentioned pain. Here we have a pretty impressive data point, a 2024 umbrella meta-analysis in knee osteoarthritis, summarizing 15 randomized control trials wherein they injected ozone into the joint. Quoting, ozone therapy appears superior to placebo, but not surpassing the intra-articular injection of hyaluronic acid. So what they're saying here is ozone is better than placebo, but not better than hyaluronic acid. But nevertheless, it makes the case that there might be some therapeutic merit for osteoarthritis. And there was another 2024 randomized control trial in those with rheumatoid arthritis, also demonstrating benefit, and other studies of various size and quality, but showing improvements in low back pain, disc herniations, neuropathic pain, and in headaches. Okay, so then we come to fatigue. And keeping in mind the impact on the mitochondria that we mentioned earlier, it would make sense, at least theoretically, mechanistically, that we could see improvements in fatigue. So a 2021 clinical trial wanted to investigate this, looking at chronic fatigue syndrome. And in this case, individuals were given the IV ozone twice per week, and after 1 month, they found a 78% reduction in fatigue and a 44% complete resolution rate. Now, one caveat here is that there was no placebo group. So it's certainly and likely that part of these improvements was placebo. But nevertheless, that's the data that we have to date on the use of ozone for fatigue. And then sixth and finally, ozone for various neurological conditions. One of these studies was a chart review. So meaning clinicians will examine a bunch of patient charts retrospectively. So this does have limitations in terms of it wasn't a clean, prospective, forward in time setup, but nevertheless, I'm just reporting on the data as they stand thus far. They gave either IV rectal or topical ozone to people with depression and anxiety twice a week for 20 weeks, and quoting, after ozone therapy, we found a significant improvement in anxiety and depression. Again, it's retrospective, it's not controlled, but interesting nonetheless. There was a randomized control trial. So in this case, we're going to have that prospective forward in time, separating out and having a placebo group. And for fibromyalgia, they found improved sleep and improved fatigue. And part of this might be due to the fact that you also, from ozone, will experience improved oxygenation of tissue. And this is because as the O3 molecule loses one of the oxygen atoms and causes that oxidative stress that's hormetic and healthy for your body, you then have left the O2 molecule or oxygen. And at least one of the theories in fibromyalgia is ischemia, a lack of blood flow and the ability of oxygen to perfuse into tissues. Regarding safety, again, it is important never to inhale, not to use if pregnant or if you have a bleeding disorder. And also, very important here, to make sure you're screened for what's known as G6PD. If someone has a aberrancy in this enzyme, their red blood cells are more susceptible to oxidative stress, and they might actually have significant damage from undergoing a therapy like this or something like high dose vitamin C, which is also actually oxidative when the doses are really high. So very important there. I would not do this therapy unless you had that screening first. And also I would make sure to check in with the clinician before you consider this therapy, just as a good practice. The dose does matter here also. As I alluded to earlier, oxidative stress from the sun, from exercise, from ozone does seem to follow a inverted U distribution, meaning insufficient load doesn't give you a benefit, excessive load is detrimental, and there's this sort of sweet spot that you want to be in. Without going too far afield into the details here, the way you dose this is concentration and volume. The concentration at between 10 to 40 micrograms per milliliter at a dose or a volume of 100 to 200 milliliters. Now, what's interesting here is that in some clinics, you will see the use of dosages that are quite north of this. In fact, Dr. Amy Offit, who was on the podcast recently, she sent me a case study of a gentleman who had a miraculous improvement neurologically. If I'm remembering the details here correctly, he was misdiagnosed with ALS and had markedly improved ambulation or the ability to move after doing ozone therapy at a significantly higher dose. So I want to be a little bit careful here, but it's always a balance between, if the clinical science is ahead of the published science, we want to be open-minded and try to not close the door off completely to where there might be potential, as long as the clinician is monitoring an individual if they're using a higher dose to make sure they're not expressing signs of excessive oxidative stress and they seem to be benefiting. So just the point there that these dosage ranges I'm giving you between 10 and 40 micrograms per milliliter at a volume of 100 to 200 milliliters are the most well established, but again, some clinicians do seem to be using higher doses successfully. The duration will depend on the condition. There are also some at-home units, and these can make it easy for people. I would advise to at least do a couple visits with a provider and get instruction on the protocol. And then companies like Simply O3 sell setups where you can then administer, let's say you're going to do rectal ozone at home. But again, knowing how to use these tools is important. So I'm a little bit wary of people doing too much without having a healthcare provider at least give them the parameters